This is Dr. Katie from Craig Chiropractic and Kinesiology, and today we're going to continue our discussion about doctors. Now, we already explained and went through the four major types of doctors, including medical doctors, doctors of chiropractic, doctors of osteopathic medicine, and naturopathic doctors. What we're going to talk about today is other common doctors that you may actually see. First one would be a dentist, right? Your dentist is a doctor. Now, it turns out that there is two major kinds of dentists. I'm learning too as I'm making these videos. So apparently there's the degree of Doctor of Dental Surgery, which is known as a DDS, or there's the Doctor of Dental Medicine, which is Doctor of Medicine and Dentistry, which is the DMD. Okay, so dentists, another type of doctor that we as humans can see. Obviously, there would be dentists for animals as well. Now, this is interesting. When we are looking up eye doctors, again, another type of doctor, there's two major kinds. Now, traditionally, we think about optometrists when we talk about eye doctors. So the acronym for them is OD, optometrists. These are doctors that train and specialize in the eyes. So these types of doctors would have the training and qualifications in the eyes to prescribe medication and things related to the eyes and even perform surgeries and procedures as necessary, and they have their own specialties. I found out that an ophthalmologist is actually a medical doctor that has done additional training to specialize in eyes. So that is the difference there. Note that under each different kind of doctor, there are many different specialties. Like if you've ever heard of a cardiologist, something like that. Those are all medical doctors, but they specialize again in specific specialties. Another type of doctor would be a psychologist. Okay? Now, a psychologist is a type of doctor that specializes in the mind, behaviors, and psychology, correct? That is a psychologist. However, a psychiatrist, again, is a medical doctor that does additional training to specialize in the mind, okay? Another doctor that you might not have thought of is a physical therapist. Now, this is more true in current times. I don't know what year it was, but there was a change in the major curriculum and requirements for physical therapists that most physical therapists these days have doctorate level degrees, okay? There's a fun fact. Previously, years ago, they only had to have, I believe, master level degrees, and now it's doctorate, so they would be considered in that doctor category now. And physical therapists are great for things like rehab, rehabilitation, things like that, prevention of injury, balance increased, things like that. Another one that is kind of interesting and you might not have thought of, but is acupuncture or acupuncturists. Now, there's different levels of training for acupuncturists. I think traditionally in the past there was many degrees that were master's degrees. Now many programs are offering doctorate level degrees for acupuncture. Now, I looked up a few of the titles and degrees that they have, and there's different variations. The degree Doctor of Acupuncture is known as a DAC, and then there's further specialties or different types. So for example, for the school I went to, they hold the degree Doctor of Acupuncture with a Chinese Herbal Medicine Specialization. These doctors would be known as DAC-CHM. So like I'm a chiropractor, my acronym for Doctor of Chiropractic is DC. These people have a little bit longer ones there. Now, acupuncturists do and practice traditional Chinese medicine, performing acupuncture on various meridians, and often use things like cupping, moxa, herbs, and nutrition to help their patients. So these are some other types of doctors you might not have thought about. All right, I'm just jumping back on here because I realized there's a couple more doctors that I missed. So those would include your podiatrist or your foot doctors, okay? That is another type of human doctor. They're known as the DPMs, or doctors of, must be podiatric medicine. Hopefully I'm pronouncing that right. I apologize if I am not. Another one is audiologists, so the hearing doctors, okay? Their acronym is AUD, so audiologists. Another one I did not consider was actually occupational therapists. Now, just to note, not all occupational therapists are doctors. Most apparently get their master's degree. There's a few that go on to get doctoral level training, so that's why I just included them here, kind of like another bonus or honorable mention. But that is another type of doctor. Wanted to make sure I was covering all the bases. And I decided in this discussion to include what I called a bonus category. These two aren't necessarily doctors, but they do come up in this discussion, so I thought it was only fair to talk about them. The first one being nurse practitioners. Now, nurse practitioners themselves are not necessarily doctors. Some of them have programs that get them to doctorate level, but not all do. So a nurse practitioner is a nurse who has gone on to do extra schooling above and beyond, usually at a graduate level, but it can vary depending on program. So nurse practitioners have the ability to do a lot more than a traditional nurse could. A nurse practitioner can diagnose conditions and treat them within the scope of their practice. The other one in this bonus category I wanted to highlight is physician's assistants, or PAs. The nurse practitioners we just talked about are known as the NPs, nurse practitioners. Physician assistants are known as PAs. Now, what are PAs? PAs in the medical field fall between doctor and nurse, so they are above a nurse but below a doctor. Here's a fun piece of history about PAs. The whole concept of physician assistant actually came from the military. Physician's assistants can do things like sutures. In some jurisdictions, they can prescribe medications, perform physical exams, they can diagnose and treat patients, and they can perform surgery they can assist surgery. Let me clarify that. They can't perform the surgery themselves, but they can assist. And physician's assistants work underneath a supervising doctor, from what I'm understanding. Something else about PAs, the programs are traditionally shorter than most medical doctor programs, and that is one of the reasons many people are going the PA route. All right, well, thank you for listening, and how about that? Did you know about some of these doctors, or was this new information for you? Have a great day, and we'll talk soon.